Pomona Valley Hospital Medical Center presents a Medical Minute on heart valve replacement with Dr. Gaurav Parikh.
So TAVR is transcatheter aortic valve replacement. So that's a procedure for patients who have severe aortic stenosis. TAVR is one of the ways in which we can replace the valve, or rather put a new valve in without having open heart operation. The symptoms of aortic stenosis: they get very short of breath, they have less and less exercise tolerance. Sometimes patients have angina, meaning chest pain, and one of the other classical symptoms is patients can pass out. There are two ways of implanting a valve. One is an open heart operation, where they open the chest up, scoop out the old valve and suture a new valve in, which is either a metal valve or a tissue valve. The procedure we are talking about, the TAVR procedure it's called, where we have a valve which is crimped on a balloon, where we go in from the leg, from the artery, and then snake that valve all the way up to the patient's native valve and position it there and deploy it. So the new valve stays in place, the old valve is squished on the side, which kind of holds as an anchor and keeps the new valve in place, and the new valve starts working instantaneously. It is safe and it is equivalent to open heart surgery, and perhaps better in some regards for a lot of patients.